my name is Jamie. I'm going to be your nurse today. Can I have your first name?
Nick,
Hi, Nick, and how old are you?
22.
Excellent. So I have you in for an abdominal assessment. I'm going to be doing lots of palpating, which is touching of your abdomen. At any moment, if you feel uncomfortable or have any tenderness upon palpation, just let me know, okay?
Okay.
Are you ready to get started?
Mm-hmm.
Excellent. I'm going to wash my hands and get started. Okay. So I'm going to have you lie back for me. Okay. So can you move your hand for me? I'm going to get down at eye level, and your abdomen is nice and flat. It's symmetrical. Your umbilicus is within midline. I see no scarring, no striae, no visible pulsations or peristalsis noted. Your skin color is appropriate for your race. Okay, so now I'm going to listen to your abdomen. I'm going to be listening to several different areas. It doesn't mean that there's anything wrong. I just want to make sure I do a thorough assessment. Excellent. So now I'm going to listen again with my stethoscope for vascular sounds, okay? Starting with the aortic, renal, iliac, and femoral. And now I'm going to listen to the bell side, which is the small part of my stethoscope. Aortic, renal, iliac, and femoral. Excellent. So now I'm going to do some general percussions, and which is tapping. Do you have any tenderness?
No.
Excellent. So now I'm going to do some light palpations, okay? Any tenderness?
No.
Excellent. All right, so now I'm going to do some deep palpations, okay? Any tenderness?
No.
Excellent. So now I'm going to do some specialty tests. No, I'm not. I'm actually going to assess your organs for swelling. So I'm going to assess your liver. Okay, so here's your rib cage back here. Now take a deep breath and let all your air out. Excellent. Is there any tenderness there?
No.
Excellent. So now I'm going to be checking your spleen over here. So take a deep breath, let everything out. Any tenderness?
No.
Excellent. So now I'm going to check your kidneys. Any tenderness?
No.
Excellent. So now I'm going to do a specialty test. Before that, when I was assessing for organ swelling, I was checking for an appendicitis here and an appendicitis here. And then I was also assessing your gallbladder up here, which is a Murphy's test. So I'm going to have you take a deep, deep, deep breath. Let all your air out. Does that hurt?
No.
That's a specialty test called the Murphy. So now I'm going to check your McBurney's point. So take a deep breath. Let everything out. Does that hurt?
No.
What about when I let go?
No.
Okay, so now I'm going to do a Bloomberg's test. Does that hurt?
No.
What about when I release?
No.
Excellent. So now I'm going to place my hands on your legs. I'm going to have you lift your leg up. Okay? Okay, so this is the Ilioso test. Did you have any pain in your abdomen?
No.
Excellent. So now I'm going to have you sit up for me and face that way. I'm going to be checking for CVA tenderness. Any pain?
No.
Excellent. So that concludes my abdominal assessment. You are free to go.
Thank you.
Thank you. I have a 22-year-old male patient who came in for an abdominal assessment. I started off by assessing his abdomen at eye level. It was nice and flat and symmetrical. His umbilicus was within midline. His skin color was appropriate for his race. He had no scarring or striae noted, no visible pulsations or peristalsis noted. Bowel sounds were heard in all four quadrant. Vascular sounds were heard at the aortic, the renal, the iliac, and the femoral, with no thrills noted. General percussion with resonance and tympany was heard. Negative for tenderness to light and deep palpations to the liver, the kidneys, and the spleen. Negative for tenderness to specialty test at Murphy's, McBurney's point, Bloomberg, or Ilioso test, was also negative. And then he was also negative for CVA tenderness. And that concludes my abdominal assessment. Thank you.